see, with the AI becoming a big deal. I mean, what has happened in the last few years, and especially with the shocker, what's it called again? That the Chinese AI company. Huh?
DeepSeek.
Yes, DeepSeek. You know, one of the things I started doing this year is that I started learning how to use AI tools. So the first 3 weeks of this year, I did at least 30 minutes a day on several AI tools. So now I use GPT nearly every day. Okay. I use DALI, their image creator. So how do you think that AI can be integrated in the medical profession in Africa?
This is a very, very good question. Something that we talk about every day in Doc Explorer. I mean, that's our team. And I was just happy mainly when you mentioned AI, because I'm a very big AI enthusiast and I use a lot of AI tools. A lot of people don't even know that you can train your AI. I train all the AI accounts that I have. I've trained all of them, and they know everything about Doc Explorer, what we are doing, and everything. And let me even introduce you to one that would be very helpful, especially for the podcast. Read AI. Read AI is a transcriptor AI model that you can invite this meeting, and then it records everything that we're doing, transcripts it, arranges it in different sections. So like when we are doing our introduction to every topic, and everything comes out verbatim. So it's very, very good for any meeting schedule or anything. And then it also brings out the written transcriptions for you, so you can have them in document format. So in case you want to edit text or put in subscripts or what it is. So yes, let's go back to the question now. We had a webinar recently, and then we were talking about how AI could solve this issue of understaffing in Africa. So you know, when everybody talks about in the Western world that AI is going to solve the issue of healthcare, the truth is it's meant to actually be the reverse. AI is meant to solve the issue of healthcare faster in Africa than in the world. Now, what does AI do for us? AI has been able to create, like, it has broken the boundaries, it has broken the borders. So, okay, like just exactly what you said now. The model for ChatGPT and what they were doing, and compared to what the model for DeepSeek was doing, and the way they were able to use lesser numbers, lesser resources to get services for, the way they were able to reduce the numbers to get services compared to what ChatGPT was doing. So you see, it has been able to, it just shows you that you can do so much more with limited amount of resources. So I was also talking to another innovator, the founder of Global Healthcare, and he mentioned something to me. They create models for, they go to a country, a region, and then they see what is necessary. So maybe like vaccine transportation, emergency healthcare units, and different things. And they create solutions for that particular region. Now, how can AI actually even help you with that? Where I was reading another article recently, and then we were talking about the medical specialties that will be replaced by AI in about 10 years. So now in hospitals, you already have radiologists that might be far away, and then they can interpret results when they do scans like CTs, MRIs, they can interpret results from kilometers away. So AI can do so much more. There are healthcare systems, EMR systems that are able to read results with AI already. So it's becoming a thing. So AI is definitely going to push out some specialties. Anything diagnosis is going to be replaced by AI. Immediately the system has tested the samples and understood the results, it interprets it generally because it's what we see every day. It can even detect more than you. The truth is, it can even detect. There are some things that your eye might not be able to see, but the system has, or maybe you might miss, except maybe you zoom in like an X-ray now. Let's say you have something we call reticular formations. If you cannot see it with your eye, but by the time you zoom it, you see it. But the AI system can pick it up. So there's so much interpretation of data. I cannot tell you the amount of data I've been able to interpret with AI. In fact, I don't even, anything that has to do with mass data again, I do not even need any.
Just push it there.
I just push it there and I drop the prompt, the criteria that I want to function, and immediately I get the interpretation of results. So and I can always edit it. I can, okay, I'm not satisfied with the result and I want it to be more precise. I can just drop the prompt and then I edit. So it's everything. So, I mean, big information, analysis, reports, everything is done by AI. And this is what most, they call them health-informed choices. You understand? Evidence-based choices. So by the time you have gotten all the data, you've done the questionnaires, asked questions here, maybe like you're looking for things like health-seeking behavior in different various communities, or maybe you're talking about an outbreak. In order to interpret results, the fastest way to do it is via AI. There are numbers, the data is already inputted. So these are the ways to solve problems in Africa. You do not have the staff to take the numbers. So imagine we're doing maybe research for pneumonia, for instance, and then we have all the x-rays of all the people, but then we're not able to, you cannot read the results of the x-rays faster than what an AI model is going to read out for you. So in a few seconds, if we have about 1,000 x-rays for chest x-rays, we will not be able to read out all the results faster than what the AI is going to read out for us. So we can make quick decisions, more accurate decisions, you understand? So it's actually a huge market, it's a big market, and that's just the beginning. We can use it for drug testing, we can use it for genetic engineering. That's even the biggest one. There are so many things. Sickle cell disease is one of the big issues, one of the big factors that we have. So it can help with. See, there are so many things. I cannot even.